Before starting this video, a big shout out to all of you that you have loved this channel so much. Subscribe the channel, hit the bell icon to never miss a video. So let's get started. So hey guys, this is me, Dr. Ashutosh Bharadwaj, aspirant of homeopathy and a creator and founder of Dr. Homeopath. 18 March 2020. In January 2020, the World Health Organization WHO declares the outbreak of new corona diseases, COVID-19, to a public health emergency of international concern. WHO states that there is a high risk of COVID-19 spreading the other countries around the world. In March 2020, WHO has assigned that COVID-19 can be characterized as a pandemic. WHO and public health authorities around the world are acting to contain the COVID-19 outbreak. However, that time of crisis is generating stress throughout the population. On 23rd March, Prime Minister Narendra Modi implemented a nationwide lockdown which saw people confined to their homes, only able to leave the house for a number of essential reasons: getting food, getting medicines, one's daily exercises, or traveling to work as a key worker. Although the restrictions are now starting to ease in India, many people have spent at least 19 weeks at home and are still unable to meet friends and family. A long period of isolation may well have been a necessary measure to protect public health against COVID-19, but it has been acknowledged that it could also have a detrimental impact on people's mental health. I have advices of series of messages that can use in a communication to support mental and psychological well-being in a different target groups during the outbreak. Advice for general population. COVID-19 has and is likely to affect people from many countries in many geographical locations. When referring to people with COVID-19, do not attach the disease to any particular ethnicity or nationality. Be empathetic to all those who are affected in and from any country. People who are affected by a COVID-19 has not done anything wrong, and they deserve our support, compassion and kindness. Second advice, do not refer to people with the disease as COVID-19 cases, victims, COVID-19 families or the diseased. They are people who have COVID-19, people who are being treated by COVID-19 or people who are recovering from COVID-19. Advices for healthcare workers. First, feeling under pressure is likely experience for you and many of your colleagues. It is quite normal to be feeling this way in a current situation. Stress and the feeling associated with it are by no means a reflection that you cannot do your job or that you are weak. Managing your mental health and psychological well-being during this time is as important as managing your physical health. Second, take care of yourself at this time. Try and use helpful coping strategies such as ensuring sufficient rest and respite during work or between shifts, eat sufficient and healthy foods, engage in physical activities, and stay in contact with families and friends. Avoid using unhelpful coping strategies such as use of tobacco, alcohol, and other drugs. In the long term, these can worsen your mental and physical well-being. The COVID-19 outbreak is a unique and unprecedented scenario for many workers, particularly if they have not been involved in similar responses. Third advice, some healthcare workers may unfortunately experience avoidance by their families and community owing to stigma or a fear. This can make an already challenging situation far more difficult. The stigma associated with mental health problems may cause reluctance to seek support for both COVID-19 and mental health conditions. Advices for people in isolation. First advice: stay connected and maintain your social network. If health authorities have recommended limits your physical social contact to contain the outbreak. Second advice: during time of stress, pay attention to your own needs and feelings. Engage in health activities that you enjoy and find relaxing. Exercise regularly, keep regular sleep routines, and eat healthy food. Keep things in perspective. Public health agencies and experts in all countries are working on the outbreak to ensure the availability of the best care to those affected. Third advice: a near constant stream of news reports about an outbreak can cause anyone to feel anxious and distressed. Seek information, updates, and a practical guidance at a specific time during the day for a health professional and WHO website, and avoid listening or following rumors that make you feel uncomfortable. Fourth advice: protect yourself and be supportive to others. Assisting others in their time of need can benefit both the person receiving support and the helper. Advices for care of children. Help children find positive way to express feelings such as fear and sadness. Every child has his or her own way of expressing emotions. Sometimes engaging in a creative activity such as playing or drawing can facilitate this process. Children feel relief if they can express and communicate the feeling in a safe and supportive environment.